Hello everyone, welcome to our channel. My name is Shrishna and today we are with Dr. Harshad Jawalkar. He is one of the leading orthopedic surgeon in Hyderabad who is also exclusively specialized in the shoulder surgery from prestigious King's College Hospital in London. Let's also meet the managing director of the shoulder center. Let's welcome him. Hello sir, how are you doing today?
Hello Shrishna and namaste viewers. I'm doing very well. Thank you so much for having me on this channel. It's my pleasure to be here.
We are so glad that you are here with us.
Pleasure is all mine.
So doctor, what is shoulder arthritis and how is it developed?
Arthritis of the shoulder. A brief introduction about arthritis. Basically, arthritis means there is some wear and tear or inflammation of the joint. So basically the shoulder has two important joints. One is the ball and socket joint and other is the joint between the collarbone and the shoulder blade, known as the acromioclavicular joint. So there can be loss of cartilage or there can be swelling, there can be destruction of the coverings of the shoulder joint, of the joint due to various causes. So all of these conditions are called arthritis. Arthritis usually presents with pain, stiffness, which causes a lot of restriction of shoulder movement. The patient can use a lot of trick movements to try to do all his or her daily things. So this is the basics about arthritis. So coming to the causes of arthritis, there are many causes. The most common cause, especially in the Indian population, is called primary or idiopathic arthritis. That means we don't know. So we don't know why it happens. It's seen in the elderly. Usually there is no obvious cause, but they come to me with pain and stiffness. We assume, lots of people assume, even lots of medical professionals, physiotherapists, general physicians, family doctors, even orthopedic surgeons, they assume that it is frozen shoulder. They start treating it, but it doesn't get better with all the routine treatment of frozen shoulder. Then we get an X-ray and we see that the joint surface, the shoulder joint is sort of wearing out. Nobody knows the cause. So primary or idiopathic cause of arthritis is one of the most important things. Having said that, arthritis can follow a lot of other conditions. For example, after a major fracture. So for example, if there is a fracture of the ball or the socket of the shoulder joint, it loses its congruency. That means the fit of the joint is lost. And just like in an engine, where because of mechanical wear and tear, there is mechanical wear and tear because the joint surface is not matching up properly. So this type of arthritis follows an injury, follows a fracture. It is known as post-traumatic arthritis. This injury, so following injury, even if there is no fracture, sometimes it leads to disruption of the soft tissues, the soft tissue coverings which keep the ball into the socket. So the most important soft tissue is the rotator cuff. So it's a group of muscles which go from the front, the top and the back of the ball. They hug the ball and pull it into the socket. Yes. This also, these muscles, they sort of help balancing the shoulder into the socket in all possible movements of the shoulder. So in some injuries, this rotator cuff gets disrupted, and if neglected in the long term, the critical function of keeping the ball in the socket gets lost. So the ball tends to slip out abnormally, then it causes some wear and tear, and eventually it develops a type of arthritis known as cuff tear arthropathy or cuff tear arthritis. So not only fractures but also disruption of the soft tissue stabilizers of the shoulder can cause arthritis. So trauma is the second cause. The third important cause of arthritis is repeated dislocations. So if a shoulder, due to some injury or due to instability of the ligaments, if it keeps on dislocating in and out repeatedly, then it can cause arthritis of the shoulder. And finally, there is a condition known as inflammatory arthritis or rheumatoid arthritis, in which all the joints of the body they get inflamed and they start wearing out. This is especially common in women, young and middle-aged women. It usually starts with pain in the finger joints, in the wrists, in the elbows, the knees and the hips, which are the weight-bearing joints. They get involved. So in this overall background of multiple joints being involved, the shoulder joint also can get specifically involved. So rheumatoid arthritis, and it has a lot of cousins. So all these cousins and brothers and sisters, they are called as inflammatory arthritis. So any cause of inflammatory arthritis also can involve the shoulder and can cause arthritis of the shoulder. Coming to the treatment, it can vary. It varies on the individual, it varies on the condition causing it, how bad the life is getting disturbed, how bad the pain is, and it also depends on what the x-rays, the other investigations like CT scan or MRI, they show up. So it's usually a stepwise progression. The mild cases, they usually get by without any major treatment, just with physiotherapy and rest, local heat, some painkillers can sort things out. In slightly severe cases, I might have to do something actively. That means I might have to give some injections into the shoulder to try to reduce the inflammation and reduce the pain inside the shoulder joints. These are temporary. These may work for a few months. These may not work at all. These may work for a few years. These are sort of unpredictable, but usually in the majority of the patients, the injections relieve the pain for at least a few months, 4 to 6 months, I'd say. In slightly advanced cases, then we have to think about surgery. So surgery again can be of different types. So it can involve just a simple keyhole cleanup of the joint and reducing all the debris and the inflammatory chemicals from the shoulder joint. In severe cases, in advanced cases, we have the options of joint replacements. So I do joint replacements of the shoulder also. So in which either the ball of the shoulder joint can be changed, or both the ball and the socket can be changed, known as anatomical shoulder replacement. Or in unusual cases, rare cases, there is this new type of surgery which is very popular in the West, in which the ball and the socket joint are reversed. That means instead of the arm bone having the ball, it will have a socket, and instead of the socket, which belongs to the shoulder blade, instead of the socket, it will have a ball. So this is known as a reverse shoulder arthroplasty. It has excellent results in a very carefully selected subset of patients. So this is also an option for advanced arthritis. And in patients who, for some reason, whether it is because of their age or whether it is their poor overall general condition, if they don't want surgery, then we have other options in which the nerves going to the shoulder joint are sort of blocked. So even though we are not addressing any arthritis per se, even though the arthritis is not being addressed, the pain signals which are traveling to the brain from the shoulder joint can be blocked. So even though mechanically we are not improving the shoulder joint function, but at least we are relieving the patients of their pain. So that is another important option that I can offer as a shoulder surgeon.
So thank you so much, doctor, for giving us informative details on the most significant body part, that is shoulder.
Thank you so much, Rujana and Suman TV. It was an absolute pleasure talking to you, and all the best to our viewers.
Viewers, please like, share and comment. You can always drop a question that you wanted to ask to a doctor in the comment section below, and please call to the number which are scrolling in our video. Plus, you are always happy to visit the Shoulder Center, which is located in row number 12, Banjara Hills. Thank you so much for watching this video.